If you're gonna say, oh, never mind.
Hello, everyone. Welcome to the COVID Survivor Diaries POTS episode panel discussion. My name is Rachel Robles, and I'm an admin for Body Politic and contributing member of Patient-Led Research Collaborative, or PLRC. There was a slight change in plan, so I'll be filling in for Fiona tonight. I'm really excited to be here, but enough about me. Let me introduce my counterpart tonight, as well as the reason we're all gathered here. Morgana is a producer, director, and the founder of Namo Media, a film production company that produces human interest stories around the world. Her clients include UNICEF, CARE, USAID, and Girls Opportunity Alliance, among others. For the last 2 years, her and her husband have gone to all 50 states to document stories of COVID survivors, many of those who have become long COVID patients. They are now producing a documentary film series about the stories of the people they met on their journey. Each episode dives into a different issue related to COVID, especially long haulers, and includes patient stories interwoven with expert interviews. You can watch the first 11 episodes now on YouTube. If you want to show your support for these stories, please head over to the Survivor Diaries channel and follow them. This will help the YouTube platform show that people care about this content. Since Body Politic is partnering on this event, I would be remiss not to introduce ourselves as well. Through a global network of COVID-19 patients, chronic illness allies, and health and disability advocates, Body Politic continues to break down barriers and patient-driven whole person care and well-being, particularly for historically marginalized communities, by facilitating peer support, cultivating patient-led research and public education, and leading community-based advocacy. Now, to introduce some of the guests that we have tonight, I want to start with our physician guest, Dr. Tae Chung. Dr. Chung is a board-certified neuromuscular specialist and physiatrist with a special interest in POTS. As a rehabilitation specialist, his goal in patient care is to restore function as close as possible to the baseline. He works as part of a team covering all aspects of this complex disorder. His other clinical interests includes myositis and electrodiagnostic medicine. His main areas of research include the effects of aging on the neuromuscular system and dysfunction of the autonomic nervous system. 1 second, I think we might be having technical difficulties. Can everyone hear me okay? Yeah, okay. Just wanted to make sure we were all together. Okay. So to introduce our patients next, Taylor Brune is a long COVID patient and POTS patient featured in COVID-19 Survivor Diaries episode 9. Taylor is a virtual assistant to physicians and a health coach to the chronically ill in California. In 2012, she was diagnosed with Lyme disease and struggled for several years to recover. Eventually, her Lyme disease went into remission, but then she caught COVID in 2020 and it reactivated her pre-existing conditions, including POTS, Lyme disease, and Bartonella. Sarah is a long COVID and POTS patient featured in COVID-19 Survivor Diaries, episode 10. Sarah is a wife and mother and has 2 dogs. She's also a semi-professional illustrator and painter and volunteer with her church. After contracting COVID-19 in March of 2020, she developed long COVID and has since been diagnosed with myocarditis, postural orthostatic tachycardia syndrome, POTS, and Ehlers-Danlos syndrome, among other conditions. Emily Zients is our final patient panelist tonight, and her bio is that long COVID and POTS patient featured in COVID-19 Survivor Diaries episode 10. Emily has a master's in peace and justice education from the United Nations University for Peace. Before the COVID-19 pandemic, she was a full-time transformative educator. sorry for that. After catching COVID-19 in April 2020, she developed long COVID and has since been diagnosed with postural orthostatic tachycardia syndrome and Hashimoto's disease. She is no longer able to work because of her condition, but has been denied disability, a struggle that many people, I'm sure, listening can relate to. But enough about me and enough with bios. We should really get to the meat of the conversation. And that's why I would love to invite Morgana to come join me in this chat as our co-host for the evening. So hi, Morgana.
Hey, thank you so much for those great intros.
Yeah.
And thank you everyone for being here. I am so delighted to bring all of you together because I've had the incredible pleasure of meeting you individually, but this is the first time you've all had the opportunity to come together. So I'm really looking forward to talking about this. We've seen POTS with a lot of the people that we've interviewed across the United States. And so it's definitely a topic that needs more research and awareness. So with that, I'll dive in. First disclaimer, though, is just that for everyone who's watching, we are not providing medical advice. Dr. Chung cannot answer any specific patient questions. This is just a discussion about POTS in general. So to kick it off, Dr. Chung, would you mind explaining a little bit of kind of what is POTS and why are there so many different symptoms related to it?
Sure. So POTS, as a lot of already probably knows, stands for postural orthostatic tachycardia syndrome. Sounds like cardiology problem, but we have to make sure that their heart or cardiovascular system is normal. But at the same time, their symptoms present as some basically blood flow problem. At the same time, their heart is normal. So that kind of suggests that there's a neural, nerve disease or neural control problem controlling the blood flow. So, so POTS has been there. Well, and the history is actually not too long. I studied POTS clinic at Johns Hopkins, 5-6 years ago from now. But of course, POTS has been existing way before. The term POTS was first coined in 1993 by Dr. Philip Lowe at Mayo Clinic. I'm sure before 1993, there was patients who suffer from POTS were probably labeled differently at the time or just dismissed as not having any real disease. But after COVID, we see acute rise in POTS, which is why we became all aware of this condition. And by now, everybody knows this is a very debilitating condition. Now, we actually prepared a small slide show to explain what POTS is. Now, this is kind of how I see POTS symptoms. This is just how I, as a clinician, when I see POTS patients, they complain a lot of different symptoms. But as a clinician, if you keep listening to all different kind of symptoms, you get kind of lost. So I need to have some kind of theoretical framework to approach these symptoms, and this is how I see it. Now you can see the Venn diagram. There's a blue on the left side and the red on the right side. And the left side, kind of forget about the jargons for now. The left side, vasomotor sympathetic dysfunction, basically means that this is a blood flow problem. So your body's really not handling blood flow really well. That, for example, your body's not really pumping enough blood to your brain whenever you try to study or concentrate or thinking, and that causes brain fog or lack of concentration and all that kind of stuff. Sometimes you try to stand up, a normal person, well, blood is a water, it doesn't go up by itself. So normally when you stand up from lower position, your body or nervous system pumps the blood against the gravity. But in POTS patient, that pump is not working. So the blood is all going pull down towards the gravity. So they get, dizziness or lightheadedness. They just can't stand for a long time because they get very uncomfortable. Now, when they try to exercise, our skeletal muscle needs a lot more blood to be, pumped into blood, and that's also not happening. So a lot of POTS patients, they have what is called exercise intolerance, and if they push through the limit, they do more than they can handle. They always get severe flare of symptoms after exercise. There's a lot of different names for it: exercise flare or post-exercise malaise, all kinds of problems. And also chronic fatigue and shortness of breath is also thought to be coming from lack of blood flow that's coming back to the heart and lung as well. So collectively, I call this pump failure problem or blood flow problem. That's on the left side of the problem, right? And you see a lot of different symptoms, but it comes down to blood pumping problem. And also you have to think about the fact that these symptoms are not always constant and not always there. And that actually sometimes deceives other doctors that they don't think is real, because sometimes they have a brain fog, sometimes they just don't have one. So, if the doctors are not familiar with POTS, they may think the patients are just faking illness or they're just whining about it, but it's really not true. And in my experience, a lot of POTS patients, they have diverse symptoms, but they are always within this kind of cluster. Now, if you look at the right side of the Venn diagram, sympathetic overcompensation, basically your body is trying to compensate for those pump failure, increases, adrenalines or norepinephrine, epinephrine to kind of squeeze a pump. So that kind of causes tachycardia or palpitation. So if you think about it, if your pump is not working, you have to beat it fast to send enough blood flow to the rest of the body. So for that, it's kind of compensation. But the problem is, if you have too much adrenaline always pumping, what happens? It's very uncomfortable, right? So when you're going to bed, you can't really sleep well because adrenaline kicks in, it wakes you up, and you have a very shallow sleep. So in the morning, you never feel rested. You get constant anxiety, heat intolerance, hot flush. Oftentimes you get GI intolerance because you lose appetite when you're too much adrenaline, fight or flight reaction, and your GI motility slows down because it's not a time for you to digest food. So it kind of causes chronic nausea, vomiting, indigestion, acid reflux, constipation that's alternating diarrhea too. So again, it comes down to, there are a lot of different symptoms, but theoretically, kind of look at those symptoms into two different categories. Of course, these symptoms are not exclusively mutually exclusive, but this is how I see that to better understand what they're going through. And also, if you look at the red and blue, it's kind of opposite in nature. So sometimes it's very difficult, challenging for me to treat those symptoms, because sometimes I treat the palpitation with the medication. It can worsen some of the pump failure problems and vice versa. So this is how I see participation, or how I explain to the patients why they have these diverse symptoms.
Thank you so much for that explanation. We had a lot of questions come in from the community, and I think you've already answered several of them just through that one explanation. So thank you. The next question is for Emily, Taylor, and Sarah. I want to hear a little bit about your journey with POTS. So I love that Dr. Chung brought up that this existed long before COVID did. Would you share kind of what you think might have triggered your POTS? How long did it take you to get a diagnosis? And then, what symptoms from what Dr. Chung just explained and from that graph have you experienced that you relate to? Emily, do you want to go first?
Sure. Thank you. Thanks so much for having me on today as well. It's a real honor. So for me, I didn't get POTS until after I had really known I had long COVID, at least. So we're talking April 2020 is when I first got sick. In the beginning of the month, I had about a 6-week mild illness and about a month and a half of feeling normal before being completely floored with symptoms all over again. in that phase, up until December, I had a physician who did not believe me and was just trying to give me more asthma medicines and anxiety medicines and things like that. So it took until finding the doctor who I have right now and really love. And that was in December. And then within 2 months, she had me go do the tilt test and the POTS test. And I was diagnosed at that time. Did I miss any part of the question? Brain fog? Okay.
Sorry, you answered it great.
Cool.
Taylor, do you want to go?
Hi, everyone. I'm so happy to be here and grateful. Thank you. So in around 2014 to 2015, I got diagnosed with POTS, as well as Lyme disease. And that's kind of how it originated, was from the Lyme. And I went in to remission from Lyme in 2017, but then when I caught COVID in 2020, it kind of flared my POTS up, and I've been suffering since. And with all the symptoms that Dr. Chung was talking about earlier, I looked at every single one, and I've just had every single one of those symptoms just flare up. And it's difficult, especially when a lot of it became managed. But I just want to encourage everyone who's going through it that there will be better days ahead. So.
Thank you for that, Taylor. Sarah, do you want to share?
Sure. So it's hard to separate everything, but so I was the first waiver of COVID, and I lost 20% of my body mass within like the first month. And so that was very dramatic. And I did have heart issues like palpitations, all sorts of heart rate problems. So I don't know if that was POTS or if it was myocarditis. I know POTS and myocarditis are very similar, but it was in July of 2020 that I started like getting like purple feet and seeing the blood pooling and all of that. But I had the brain fog, and I just felt like concussed all the time. And of course, chest pain. And so I advocated to start physical therapy because I was like, I got to get out of this bed. And it was very hard to see a physician in person because everything was shut down, So finally, I was able to get physical therapy, and I started getting worse. It was like movement just wrecked me. And I kept telling them movement is just making everything worse, and they couldn't understand it. And I couldn't, so I had to stop. I got a resurgence of like COVID-like symptoms. I mean, it was just a mess. But then I got into a COVID clinic in winter of, 2021. So in the January. And then I saw a cardiologist maybe like 9 months after that. And we got the resolving myocarditis at that point. But it wasn't until I got my third neurologist to diagnose the POTS. And so it really took everything I had to keep pushing forward. But I finally got a physical therapist who saw, all the nerve problems to get me to that neurologist. And now I have medicine for the myocarditis and the POTS. And it wasn't until I formed like both of those that I really started seeing improvement. I had the salt that I was doing, but I really needed the beta blocker and the POTS medicine together to move forward. So that's my story.
That's a great segue into our next question. But first, does anyone want to respond to each other on that? I think you've highlighted how challenging it is to get a diagnosis. And if people out there are watching this, you are not alone. It has been very challenging for everyone we've spoken to, for everyone here to get diagnosed. Does anyone else want to comment, or shall we move on? Okay, I'll move on. So this question we get asked a lot, and I know it's complicated, but and I'm going to remind everyone, this is not medical advice. This is a discussion. So every patient is different, and please speak with your doctor. But I would love to hear from whoever wants to share what treatments are working. Taylor?
Hi. So because not only did my Lyme flare up with my POTS, we've noticed, my doctor and I have noticed that they coincide together. When my Lyme is not doing well, my POTS gets more aggravated, more exaggerated. But when my Lyme and the co-infections of the tick, tend to go into remission and I'm doing better, my POTS tends to be more managed too. And so during this time, post-COVID, I've noticed that the weekly IV fluids right now, the lactated ringers, IV fluids have really helped my blood pressure, as well as just like energy with the fatigue, has really helped me be able to just kind of feel a little bit more myself. I am currently not on any medications because they go against some of my Lyme treatments and we don't want to cause more issues. So I've been doing it like with the compression socks, that's been helping, the salt, the minerals, added minerals to my filtered water. I like this, once again, not medical advice, but this is what my doctor has really found helpful to me. Licorice root has really helped bring up my blood pressures because they were going down pretty low. And when I take that daily in accordance with my compression, my salt, as well as my fluids, he notices a difference, and the nurses notice too that it stays more stable rather than going, a little bit more hypotensive. But I'm more of the smaller ways of helping manage the POTS daily, and that's been good, as well as smaller meals throughout the day with the digestion, and that's definitely helped. So
I know you've been through a lot of ups and downs with this, so that is coming from a lot of experience. Dr. Chung, do you want to answer?
Yeah, I can add a little bit. Taylor did a great job in explaining the very typical standard treatment for POTS. And I'm going to actually add a couple of things. First, well, unfortunately, there's actually no, we call this disease modifying treatment, something kind of treatment that can address fundamental problem, because we don't even really know the cause of this problem. But the good news is that there are a lot of things we can actually do. I mean, this is really not one of those conditions where there's nothing we can do. As Taylor mentioned, there are so many different things we can try. There are so many different medications, basically targeting towards to what is called bottom expansion. She's getting some IV saline infusion. We ask patients to drink a lot of water. That's really targeting blood flow kind of problems. And I also want to have to tell you that there are a lot of different kinds of medications, but as you remember, those symptoms are a little diverse and sometimes it can appear different symptoms. So our approach should be flexible and also diverse as well. It should be very individualized. So for example, so same medication that Taylor's benefit from doesn't necessarily mean that it's going to work for other people. And even for Taylor herself, it may work for this time, but may have some side effects later on. So kind of a little, flexible and very individualized. I think that's kind of important to know. And by the way, licorice root, just speaking of that, that's actually naturally occurring steroids. There's a lot of steroids there. So it has a very similar fludrocorticoid steroid effects on it, which is why people kind of like it too.
Taylor, did you want to add to that?
Yes, I forgot to mention, I've also been doing the cardiac rehabilitation that my cardiologist has got me into. And there's different programs at different medical centers. But here I go in San Diego, California, to Scripps Cardiac Rehab Center in La Jolla. And right now, currently, I'm at home doing it, but I was doing 3 times a week in the gym. And what they have you do is very light stretches that kind of help you transition from, sitting, standing, moving, lifting arms, and it just strengthens you the more you do it. And like lifting weights too to help, but very, very lightly, because I noticed when I overdid it, it brought symptoms. So it's very individualized and it's very slow, and you're monitored by nurses with your blood pressure and your heart rate throughout the whole working out process. So I did want to mention that in case anyone, their cardiologist, if you want to mention it to your cardiologist or neurologist, see if cardiac rehab is available to you, because it's a really good way to strengthen yourself. And then adding in like slow daily walks too. I forgot to mention, those have really helped.
Does anyone else want to share their experiences with the treatment?
If I can add just one more thing about the cardiac rehab, that's rehab and exercise is incredibly important. But whenever you're looking for cardiac rehab, typical cardiac rehab will be very tough for a lot of POTS patients. It can bring up a lot of post-exercise flares. So you have to tell the doctors that you have to start much, much, much lower than they usually do for other patients.
So follow-up question to this is, are there any potential future treatments that are currently being researched right now? What can patients potentially look forward to?
So in general, especially for POTS after as a long COVID syndrome, I think I'm personally interested in looking for autoimmunity. It's post-infectious syndrome. So not all post-COVID syndromes are the same, but subset of post-COVID syndrome that's presenting as POTS for long term, I suspect this to be immune-mediated, meaning autoimmune condition. And I think that's a very important for research topic, because if you can prove autoimmunity, there are a lot of medication that can potentially manipulate your immune system, and they can control your immune system. So that's going to be disease-modifying treatment for POTS. And unfortunately, there's nothing available at this point. But I know, including mine, I know there are a lot of other efforts going on to, try to identify autoimmune markers, and also potentially even some interventions to see if we can improve their symptoms.
That sounds really interesting to me, and I can't wait for the research to come out on it. So my next question is about the vaccine, which, as we all know, is a very controversial topic. I'll let everyone decide I'm not going to put anyone on the spot for this question. A lot of people have commented, I'm sure everyone's been seeing it, about whether or not the vaccine causes POTS. So I'll ask, does the vaccine cause POTS? And if you want to share your vaccine status, you can, but I'm not going to say anyone. So that's up to you if you want to discuss that or not. So Dr. Chung, do you want to start?
Yes, and if anybody else wants to share the story first, and I can kind of wrap up too. But do you have any honest stories about vaccines that you either fear or good or bad?
Great question.
Okay. Oh, go ahead.
Emily.
Yeah, it's a really complicated subject to breach, and I can say that my first two vaccinations were A-okay. I had a very normal couple-day reaction, and last August, I'm pretty sure, it's so hard when you go into a flare-up to know which of the conditions. Was it the wildfire smoke? Was it the heat? Was it, what's causing you to flare up and stay flared up? But I was in a pretty serious, about 6-month flare up after it lining up with the time that I got the booster. And still, I feel a little bit on the fence because I want the next one so bad. It feels really deeply complicated to me. So I probably won't, because that was some of the darkest days I've experienced in the last 2.5 years, was that really extended, just being in bed, not being able to breathe, chest pain, etc. Dark days, but I wish I could, for sure.
Sarah, go for it. Sorry.
So kind of what I was thinking when people ask me about that, there was that hot topic of, the vaccine will cause myocarditis. Well, now it's about maybe the vaccine will cause POTS. And the vaccine is supposed to mimic the actual virus. So I got myocarditis and POTS from the actual virus. And so, I mean, there's a chance to get it either way, But how I look at it is, so I've gotten COVID 3 times, and each time the POTS got worse. I have myelitis, so I get like in a palsy state. I'm actually doing a treatment right now, which is very promising. But it affects the POTS, it affects the heart rate, all the nervous system for me gets affected. But that's very rare, And so I think people just got to take in their medical history and see what they're comfortable with. So I currently am not vaccinated because my immune system isn't getting the memo with the real virus. And I just can't even fathom getting that in me, So we've just waited on it and just hope, like the Paxlovid's really helped with the last virus that I got. So there's that if you choose not to be vaccinated. Now we have those antivirals, which have really changed the game for me. So
Thank you for that, Sarah. Taylor?
Hi. So I'm similar with Sarah. I got all of this flare up from the virus, a really intense case in 2020, and then I got COVID 2 more times this year. And so it is an individualized choice with your genetics, with your flares, with your autoimmune issues. I have other autoimmune issues like type 1 diabetes. So I've just been in a flare, and I personally did not choose it just because, like Sarah was saying, my immune system is completely shot. I had a really severe reaction to MMR vaccine in 2020 for work that I had to take for working at a hospital. And that I did fine when I was younger. So it brings up the issue is my body post-COVID, am I even able to handle vaccines since I had such a severe episode after that, after the simple MMR one. And so I personally have chosen not to. And that's just because I really want to work on just repairing my body and my immune system so that I can be able to fight off other infections other than COVID too. But yeah, I think it's everyone's choice. And it was just very interesting working in a hospital during the pandemic and seeing everyone's reactions to it. So it's definitely very individualized because some people didn't react to it, but many patients, many staff members did react to it, had post issues as well. So it really just, I think, depends on the biology of our bodies and what your doctor and you talk about and recommend. So, yeah.
Thank you all for sharing your personal experiences with it. I know it's not always easy to talk about that part. I'm going to hand it back to Dr. Chung, but I just wanted to say thank you for sharing your stories.
And thank you. And I wanted to hear your story first because I think, as you probably know, experience and myself as well, a lot of doctors just try to ignore or dismiss their kind of fear about vaccines. So I really wanted to hear from you first, what you're really afraid about vaccines, right? Overall, I think POTS patients, there are a lot of different reasons that their symptoms can get flared. And oftentimes it's just a dehydration. I guess a lot of POTS patients, when they drink a lot of wines, their hangovers are really bad or flare up because they get dehydrated severely. So they stop drinking. That's one of the very few good things out of POTS, I guess, if it's a good thing. But, and also, I found a lot of small inflammation, systemic inflammation, whether it's viral infection or even vaccines, can flare things up. It doesn't matter if it's a COVID vaccine or flu vaccine or before COVID or after COVID. vaccines in general, and we know that COVID vaccine can cause a little more inflammation. It's actually a stronger vaccine because it causes a lot of different immunity against the virus. So, I mean, I don't have POTS, but I got pretty bad, side effects as well. So I can imagine a lot of COVID patients, post-COVID patients developing some flares and severe reactions to the vaccines too. Now, I think Sarah made a really excellent point, and that's exactly how I see it, because the vaccines are kind of mimics of the virus. It's actually a small portion of the virus. So not only COVID vaccine can cause flares because it causes systemic inflammation, theoretically, it can also cause new POTS on somebody who actually never had it. But at the same time, if vaccines can cause it, actual virus can cause a lot more inflammation, or from the immunological standpoint, there's a lot more chance of developing post-COVID POTS after having actual COVID infection versus a vaccine. And unfortunately, in ideal world, we don't even have to get the vaccine, but unfortunately, still the COVID virus out there. Actually, recently, a lot of my family members recently got COVID infections, and it's still out there. So to be honest, there's actually probably more chance of having even more severe COVID the POTS flares after actual COVID infection, or just developing new POTS after actual COVID. That's why overall, I do think it's preventive. Even for long COVID POTS, I do think it's preventive. So I completely understand your fear, but when you're afraid of that, I also want you to think about another part of the equation where you get actual COVID infection and may have another major flares of POTS and so on. So that's kind of my perspective. That's a little more technical from Sarah's point.
Thank you so much for that. I know this has been a really polarizing topic in the United States, especially, and it's really hard to have calm conversations about it. So I'm so thankful when we can have just open discussions about it. Does anyone want to say anything else about the vaccine or this topic before we move on to community questions? Emily?
Yeah, I just want to say, first of all, I also already was diagnosed with POTS before I had the booster that flared me up so much. And the second part was all that I've read and heard from my doctor about many cases of people improving from vaccinations as well from their long COVID. So it is just a really impossible decision on some levels that kind of is driving me crazy. But I appreciated hearing from each of you. That helps a lot.
You're definitely not alone in it being a very hard decision. Okay, we have been collecting questions from the community over the last week through Body Politic and Survivor Diaries. And Rachel is going to share a few of their questions to you. So I'm going to hand it over to Rachel.
All right, thanks, Morgana. This has been an awesome discussion thus far. And I think we were able to touch on treatments a little bit, but I definitely want to dig into it a little bit more. Dr. Chung, I know you had mentioned post-exertional flares, and I definitely want to bring that into the equation because we got questions about how we address treating POTS when you also are dealing with PEM or post-exertional malaise. So I would love to know about that, especially on specific treatments as well. We were asked about like if Mestinon is working or anything else that you have found.
Regarding the PEM, right?
Yes.
Yeah, so that's a very good question. Well, again, there's a lot of research going on to try to figure out what PEM is. But again, like I see that it's more blood flow problem, basically. And there's actually really amazing research from, his name is Dr. David Sistrom from Harvard. And he kind of he's shown that in his research, actually it was before COVID and after COVID, the post-COVID syndrome patients, he did the same thing. He actually put a lot of different central catheters, arterial lines in the patient have been exercised. So that way, it's a very invasive study, but that way you can see actual cardiac physiology, what's going on with the exercise. And that's really one of the rare kinds of great studies. And he's basically shown that normal person, when you exercise, more blood is returning back to the heart and lung. But in POTS or post-COVID patients, that's actually kind of reduced. And that's kind of thought to be the basis of, those post-exercise malaise. They just don't have enough fuel, generate enough fuel, which is blood, when they do exercise. So in practically, when you approach those patients, like I said, cardiac rehab or exercise is very important. But how do you do exercise if they cannot tolerate the exercise? That's actually a big conundrum that we have, and it's a really challenge. It's not. There's no one way of doing it. But in my experience, they can actually advance basically it's a graded cardiovascular training. They start from the very low level and they're pushed very slowly, advance their limit over time. And it's very doable. It just takes a lot of time in the beginning, like with the volume expansion that I mentioned, try to supply more blood volume, increase blood volume to the body, tends to be kind of helpful. Again, this is a challenge. It's easier to say it, and it takes at least several months and a lot of efforts to get there. Mestinon, beta blockers, sometimes midodrine or fludrocortisone. Those are medications that can be used in conjunction with exercise, and sometimes IVCN in bolus infusion that Taylor's getting. I sometimes use it. They have a lot of post-exercise malaise as they are doing the physical therapy and exercise. So not an easy answer, easy to do it, but theoretically that's kind of a blood flow problem. And there are some ways to handle that.
Awesome. Yeah, I think even your emphasis on just how slow the process is important because many of us deal with that internal pressure to figure out what's going on now. And we have to give ourselves grace.
A lot of my patients are young female who used to be straight A student or high achievers. So I think that doesn't help when they do exercise because, they're used to acing everything and then they have to be very slow.
Yep. Pushing it to the limit is like what we all know. Awesome. So one question that I have for you is, about the features of long COVID POTS. And I just wanted to know whether you're seeing similarities or even differences between your long COVID POTS patients versus your traditional POTS patients.
It's to me, right?
Yeah.
I think essentially it's the same. Like I said, not everybody has all the symptoms at the same time, but I feel like this is a little bit of kind of phase or stages too, temporally, meaning over time. Their symptoms tend to change a little bit too. Either POTS or post-COVID, in the beginning, they seem to have a lot of palpitation and cardiac symptoms. And over time, it becomes more chronic fatigue and GI symptoms and other things too. I guess this is kind of still early in the stage of post-COVID, so we see a lot of palpitation, tachycardia as well. But essentially, I think they are very similar.
Yeah. Does anybody have anything else to add to that before I move on? Oh, Taylor, how about you?
Yeah, and it's very interesting because, before COVID, POTS was not heard of by a lot of people, patients, and especially doctors. Like it was very difficult for me to get the test, but I didn't even know about it. It was one of my Lyme doctor who would witness the POTS developing during their Lyme treatments. So if it wasn't for him, I would have never known. And so he sent me to a cardiologist before his wait list closed up, and I was able to do the tilt test, and he diagnosed me with POTS. But it is interesting because now it's kind of a blessing in disguise to bring more awareness to it, because even though it may stem from different infections, different autoimmune, whatever it stems from for different people, whether it be COVID or not, we're all experiencing similar journeys of, what's going on with our bodies. Why are we not able to tolerate walking or heat or a concert or a movie theater with the stimulus? where it gives you the panic and anxiety and the depression. And luckily, a lot of these people have been experiencing this the last 2 years, but now that POTS is being discussed, brought, more awareness. They're getting their answers to what's been going on, why they're losing their health at whatever age they've been losing it at. And, it's sad, but it's good in the fact that we all are on the same journey. We're all experiencing similar struggles and challenges. And it's a blessing in disguise that it's just brought more awareness and talk and discussion, especially with tonight's panel too. This will help a lot of you who have been suffering the last 2 years and have no idea what's been going on, because it affects every part of your system and your life, not just your temperature, your heart rate, but your digestion. So yeah. And I did the tilt test for the diagnosis through a cardiologist, just for anyone who wants to write that down, or yeah. Okay, thank you.
That's awesome. No, thank you so much for adding onto that. And I think we have a lot to learn from chronic illness patients prior to COVID. We're not doing anything alone here. If we want to move on to sort of a different topic on this, a lot of people have been asking, and I feel like we definitely should touch on this. If not like a big explanation, it could just be a short answer. But Dr. Chung, does POTS go into remission, and can one fully recover from it?
Well, that's also a very good question that I get all the time. And at this point, unfortunately, nobody knows for sure. And also, I also want to emphasize that both POTS and post-COVID syndrome are clinical syndrome. It's not a one single disease. So which means that I termed as a POTS or even long COVID, there may be different diseases and they may have a different prognosis or net course of diseases. But I think for a lot of POTS patients in general, regardless post-COVID or not, it seems like it's very chronic problem, which is why I suspect this to be immune-mediated inflammatory problem. So they have immune system as a memory, and they recognize our nervous tissue as an enemy and keeps inflaming it. So as in a lot of other autoimmune neurological conditions, it seems to waxes and wanes over time. So even without any treatment, there are some days or years that are doing much better. May not be completely normal, but they are much better. But then it flare up and kind of down over time. That's very typical for most POTS. I'm not saying everybody.
Yeah, I know it might not be the most satisfying answer, but dealing with a little bit of uncertainty, but hope is, I feel like, probably one of the best answers to have. Awesome. I want to pivot to the actual diagnosis part. And I want to bring in the patients here as well, because we've gotten the question about, who do I go to get a POTS diagnosis? I know personally, it's like the cardiologist is, throwing you to the neurologist who's throwing you to somebody else. And so they don't want to agree on who even makes the diagnosis itself. So let's start with the patients first and ask, who was it that diagnosed you? Like, was it multiple people working together? How did it go? And then we can bring it off to Dr. Chung to see what his thoughts are too. Who wants to go first? Sarah.
Let me unmute there. So man, was that a hard thing to get diagnosed with really anything. So I didn't see a cardiologist until like a year and a half. And so I see neurologists, and yeah, sorry, this is at the end, and I all my blood is in my feet right now. So what was the question?
I know how you feel. Don't worry.
So how did I get diagnosed? That's what it was.
Yeah. Which type of specialist?
Okay, so my cardiologist was treating me for myocarditis, and I went to another doctor and I was telling him, how it went. And anyways, it wasn't a good visit with that doctor. And he's like, oh, that sounds like POTS, except he used, the long term. And so he said, well, let me put you on Midodrine and let's see if that helps. Well, it totally helped. So he didn't actually say I had POTS, but he gave me a POTS protocol. But then I went to that neurologist because the previous one wouldn't do the tilt test, wouldn't even acknowledge anything for long COVID. And so, and that was neurologist number 2. And so the third one just looked at my history, looked at the meds I was on, and then did his own diagnostics. And they gave me the diagnosis that way. And so it was kind of like cardiology and neurology were working together, but I don't know. It's just a process and it's confusing. So I can't wait for it to be streamlined. I know a few of my doctors would take my blood pressure sitting and standing, but it was like they would do it right after the other. They wouldn't wait, 2 minutes or 10 minutes, And so it's like, well, I'm getting the POTS symptoms now later after you just did the blood pressure, So I feel like they don't quite understand how important it is to wait between, being horizontal and then vertical. So anyway, I hope that helps. So
I think that helps a lot. I think there's 3 different things that I got from your answer too, which was there's 3 different types of or 3 different ways to diagnose a patient, and it's clinical diagnosis. There's a diagnosis by tilt table test or some other test to inform it. And then there's also the treating the thing we think it is, and then making the diagnosis when, the Midodrine worked. I'm sure there's other methods of diagnosis, but that's what I pulled from your answer. And I think it's really beneficial for other people to see that those are all the ways that it can be done. I see Taylor wants to respond, so go ahead.
So I want to make a note. So what's really important is if you do go to a neurologist or cardiologist, you want to make sure that they are specialized or have experience with autonomic nervous system and autonomic testing, because the tilt table test is through autonomic testing. And so that is a term that not many patients are aware of. And so when I was talking to my cardiologist, he mentioned not every cardiologist has research or experience with autonomic nervous system diseases as well as the cardiac diseases. So that's really something key to look for in your specialist is the autonomic, because that's what's going to help you get there quicker to your diagnosis and the right tests for it.
Definitely need to be in the right rooms with the right people. Emily, did you have anything to share on this?
I honestly don't remember which doctor it was because I've been to so many doctors in the last few years. I do know that I had a really traumatic reaction to the tilt test. And just the whole experience. There's some other tests leading up to it for about an hour or so. And they almost didn't diagnose me because I burst into tears when the table went up, because I just felt like they were poking at all my wounds for the last hour or more. And I was in a flare up anyways. And so it's like, you're making me more sick when I feel so sick. And then it went up and I just kind of was like, oh, and they said that they thought that I came in a panic attack or something, and that they were trying not to count it. So my doctor backed me up, as well as I jumped like 35 beats or something, I think even like 40 or more. Like I have it. So that was really disappointing.
Oh man, that is awful. I'm sorry. And I've heard that way too often too. So I'm glad that that is over and we can look forward and we can move forward with this diagnosis that we all have. Dr. Chung, what additions do you have for this question?
Well, just quick, I sometimes diagnose POTS in easy way and very difficult ways in both. And it kind of depends on, my intervention. I try not to do extensive diagnosis workup unless the results of the workup actually changes my, overall plans. And as I mentioned, I start with this treatment with the volume expansion. Oftentimes it's just a little bit of a, not that it's easy, but it's more, lifestyle changes, drink a lot of water and salt. So, and if the patient has no other medical conditions and relatively young, there's no other reason to suspect either heart problem or lung problem, and they suddenly develop those. And active standing tests in that case is enough for me. I don't have to, kind of go through all these tilt table tests and torture, and I can start certain, treatments and see, what happens. And at the end of the day, even if I'm wrong, it's not POTS, they're feeling better, I'm kind of happy with that anyways, right? But of course, there are certain situations where they have some pre-existing conditions, and I need to make sure this is not from heart, this is not from something else, and I can go like whole 9 yards of extensive diagnostic testing. So it kind of depends on their clinical situation. That's just my approach.
Oh, that's great. Thank you so much for that, for adding color to that. I see that we're over on time, and I want to be mindful of everyone's energy, my energy. Let's all be nice to ourselves. So I do want to leave it off with one last question to Dr. Chung. And this is, what are you hopeful about in regards to POTS and long COVID? And, you talked a little bit about research that you're looking out for. What are you looking forward to, and what hope can you bring to our communities?
Yeah, many things. And in a way, in a weird way, I think, COVID pandemic has brought some good news to, POTS community. I'm not happy that people are getting POTS, don't get me wrong. But as Taylor should probably know that. Before COVID, POTS was actually not a thing. It's been completely ignored by a lot of doctors. And somehow, I don't know, a lot of people, without any evidence or, ground, a lot of doctors think this is just, fictional, it's not a real disease and that kind of stuff. So I think it already has brought up a lot of attention and increased awareness to, more importantly, to doctors and patients. I think that's good. And then I really want that trend to continue to develop. Of course, I personally, want to engage in more research and prove autoimmunity or some actual disease-modifying treatments. So again, autoimmunity is one of the theories out there. There are a lot of other theories about long COVID and POTS, and there are a lot of really smart people working on this syndrome. So I think, in the long future, maybe somebody can discover really cool things that may even lead into a Nobel Prize or something like that. So I think it's a crisis brings all the opportunities. That's how I see this kind of problem. So the research is our hope.
Beautifully said. Thank you so much, Dr. Chung, and thank you to Emily, Taylor, and Sarah for using your spoons on this. It's really, really appreciated. I also want to thank Morgana and COVID-19 Survivor Diaries. Without this, none of this would have happened. So, and then finally, thank you to the BP administrators, Lita and Marissa, for also being behind the scenes and making things happen today. On behalf of Body Politic, the grassroots organization at the forefront of the patient-led movement for long COVID, thank you for joining us wherever you are. We are an entirely volunteer-run organization made up of largely COVID-19 patients. If you'd like to support our work, please contribute to our fundraising campaign by donating to Springboard Health Lab's PayPal found in the YouTube description and chat. As BP is now a fiscally sponsored organization, donations made through our sponsors, Springboard Health Lab, are tax deductible. Sorry, there's a lot of words there. donate to Springboard Health Labs PayPal. And we can attach that link there in the chat. And then you can also sign up for our Patreon, sign up for one of our tiered sliding scale monthly donations, starting at $1 and up to $30 per month. Again, thank you everyone for tuning in. Have a great night.